PriorityVax, an online tool to help priority setting for vaccines within an evidence-to-recommendation framework. Users are taken through a process of comparing different vaccines or vaccine characteristics as part of a priority setting and decision-making process. Over the last 20 years, the successful investments of the philanthropic and donor community, along with innovative financing of Gavi, the Vaccine Alliance, have resulted in accelerated access to and use of over a dozen new vaccines in low and middle-income countries. Resources are never unlimited, but in environments facing considerable financial and functional constraints, health systems and donor organisations increasingly recognise the need to support well-informed processes for priority setting. That's the critical process of selecting between alternatives and balancing competing needs. Processes that account for local context, effective and especially sustainable decisions about introducing new or underused vaccines, or selecting between alternative vaccine products. PriorityVax supports locally relevant information and decision-maker expertise that is aligned to the public health needs of the population when couched within a country's context of programmatic policy needs. PriorityVax can strengthen the functional capabilities of NITAGs, the National Immunisation Technical Advisory Groups, and national decision-makers for successful priority setting by supporting transparent and credible evidence-informed priority setting recommendations, promoting country-level ownership of decision-making, and improving political commitment to and effectiveness of expanded coverage of immunisation programmes. Sabin's PriorityVax platform has evolved from an initial conceptual framework that emerged from earlier tools developed by the US Institutes of Medicine and the NIH's Fogarty International Centre. The Sabin Vaccine Institute is a leading advocate for expanding vaccine access and uptake globally, advancing vaccine research and development, and amplifying vaccine knowledge and innovation. As a non-profit with more than 2 decades of experience, Sabin is committed to finding solutions that last and to extending the full benefits of vaccines to all people. Sabin's vision for PriorityVax is to make this valuable tool more widely available in order to promote appropriate and sustainable vaccination around the globe. While it won't and shouldn't make the decision for you, going through the steps of PriorityVax encourages users to think about different, sometimes competing priorities that are important for shaping vaccine-related decisions. In a stepwise process, the platform directs you to define your target population, enter disease and vaccine characteristics, and then to identify the country's key vaccine needs, attributes or criteria that guide your decision. You have the option of selecting from a pre-populated list or creating your own attributes, then giving them relative weights that reflect the importance of each criterion. They can be equal or made to differentiate elements that are more or less important to your decision making. You then enter evidence, which might be qualitative or quantitative, and then PriorityVax displays your results, showing how each vaccine is scored based on your criteria and the evidence available. PriorityVax is specifically built around a like-for-like comparison, illustrating which vaccines best meet the criteria given the evidence provided. Uncertainty about the data that is used in your analysis, or if a committee have differing opinions about the level of importance for decision attributes, can be addressed by easily and interactively reconfiguring the analysis. You might have access to new evidence, or want to explore a range of published values. You might want to explore alternative future scenarios, such as costs with and without co-funding. This tool is designed to explore different perspectives and to facilitate consensus building in your process. In an easy-to-share report, PriorityVax produces not only analytic results, but also a record of how these results were achieved. The shareable report provides a transparent view of your decision-making process, the data inputs, weights, and information resources, as a way to communicate and support the recommendations or policies resulting from your deliberations. The decision matrix can be used to facilitate exchange with immunisation stakeholders, such as practitioners, ministries of health or finance, public health agencies and donors. The reporting capabilities provide a documented, reproducible record of the decision making and demonstrate the use of evidence, the development of a repository of data or information used in the process, and can include a bibliography and notes about the process itself. The report enables transparent information sharing that highlights and distinguishes between the importance of local context for the NITAG decision-making process and the consideration of locally relevant disease epidemiology or other programmatic constraints and priorities. PriorityVax is a tool that aids in guiding and defining an evidence-informed priority setting process. The tool's outputs include transparently capturing the components of the process and the data so they can be most effectively used to influence decision-making and implementation of vaccine and immunization priorities.